And welcome back to the Wellness Paradox podcast. I'm so grateful that you can join us on this journey towards greater human flourishing. As always, I'm your host, Michael Stack, an exercise physiologist by training and a health entrepreneur and a health educator by trade. And I'm fascinated by a phenomena that I call the wellness paradox. This paradox, as I view it, is the gap in communication and interaction between medical professionals and fitness and wellness professionals. This podcast is all about closing off that gap by disseminating the latest, most evidence-based, and most engaging information in the health sciences. And to do that in episode 33, I'm delighted to be joined by Amy Bantham. Amy has a background in fitness, but also in public health, actually working at IHRSA for several years, starting as a group exercise instructor, working at IHRSA, our national trade association in the fitness industry, and then going back to get her PhD in public health. And Amy is intensely passionate about making health clubs a essential community resource. And as we get into the conversation, you'll hear us talk about language a little bit in the beginning and how the term health and fitness clubs is something that Amy, as well as myself, will very intentionally use in this discussion. We're going to talk about a number of things in this conversation, most of which focus around how health and fitness clubs are viewed as that essential community resource, but also the steps that we need to do to get there. Some of the themes you're going to hear have came up on the podcast before. Other themes have not. I think you're going to greatly enjoy this discussion. A lot of good food for thought and probably some action items for you to take away. Anything that we want you to physically take away from the podcast, we'll link up to on the show notes page. That can be found at wellnessparadoxpod.com/episode 33. Hope you enjoy this conversation with Amy Bantham. Today, we're delighted to be joined by Amy Bantham. Amy, thank you so much for joining us.
Thank you. I'm very happy to be here with you.
Yeah, super excited for this conversation. And this is a discussion that actually comes as a outgrowth from a lecture that I listened to you more or less moderate down in Dallas at the IHRSA conference. And we're going to get into this discussion of health clubs as an essential community resource, which was the presentation I heard you moderate. But before we dive into that, why don't you give everyone a little bit more of an idea of your background, just for some context for our discussion?
Sure. Yeah, I've been in the health and fitness industry for over 20 years, and I came to the industry as a group exercise instructor. And it was something that I started doing. I started taking classes, and my instructor pulled me aside and said, you should really think about becoming an instructor. So that was my entry into the industry. And I've been very happy to be a part of the industry for that long. I worked at IHRSA for over 10 years and ultimately decided to go back to get my doctorate and got a doctorate in public health. And I did that because I wanted to bring the health and fitness industry and the medical and healthcare and public health communities closer together. So I was really looking at integrating healthcare and health and fitness. And as I was doing my doctoral field work, I was working in a healthcare system out in Utah. And I was doing work that addressed non-medical or social determinants of health and bringing healthcare out into the communities. And so that was the missing piece of what I wanted to do. So I launched Move to Live More, which is my research and consulting firm, really to integrate healthcare, health and fitness, and communities to address physical inactivity. So that's where I am right now. And that's how it all started over 20 years ago.
Yeah, I love it. I feel like we're somewhat kindred spirits here in the sense that, I came up as a personal trainer in the field, started my own fitness company, and now I have recently gone back to get my master's in public health because I have a very similar interest to doing what the path that you've gone down. And I think that's why this is going to be such an exciting discussion and why I wanted to connect with you after hearing you chat at IHRSA. And we'll talk a little bit more about Move to Live More. I think that'll provide some additional context for our discussion.
Yeah, so it's really trying to knock down silos among those three sectors. And I'm a mixed methods researcher. So much of what I do for clients is qualitative and quantitative research. I also do program design, implementation, and evaluation. I do strategic consulting, strategic planning around health and fitness, physical activity, chronic disease, prevention, management, and treatment, and addressing social determinants of health.
That's great. And just for some context for the audience, we've mentioned social determinants of health a couple times on the podcast, but since it's came up a few times and we're talking about community resources here, can you just give us a brief definition of social determinants of health and why it's important in this context?
Yeah, well, I can give a definition through an example. So I can talk about some of the work that I was doing at Intermountain Healthcare, which is really the goal of the healthcare system was to decrease healthcare spending and improve health outcomes. And so much of health outcomes are determined by things that take place outside the healthcare setting. So I think it's 10% in the doctor's office, 90% outside the doctor's office. And so what we were doing is really going out into the community and working to address housing instability, food insecurity, transportation challenges, and lifestyle behaviors are part of the non-medical determinants of health, and physical activity and access to physical activity opportunities being one of those. So how can we intervene around these non-medical, these social determinants of health to improve individuals' health, as well as to improve community and population health? And that is so much a focus of what I do. We hear the term in the industry, medical fitness. And to me, that is not medicalizing fitness and bringing fitness into a healthcare setting. It's really having a provider counsel a patient to be physically active and then referring them, giving a nice warm handoff to a community-based health and fitness club, a community-based health and fitness professional. And so they can, instead of doing fitness for 10 minutes in a doctor's office, really starting a fitness program, starting a fitness habit that will continue over the course of their lifetime. And so it's not this like discrete 10-minute intervention. It's an intervention that continues and becomes part of someone's life.
Yeah, that's perfect. And I think a lot of this, and I hope COVID has, if we could take anything good out of the COVID period, it's gotten all the people in allied health to expand their perspectives, realizing that it's a lot more than just what happens in the clinical setting. And to that end, as I said, the talk I heard you facilitate at IHRSA was health clubs as an essential community resource. And that's a little bit of what we want to talk about. And I know that we talked previously about how language matters a lot, and we're using the term health club here more often than gym or fitness center. And I think that's the first place I want to start before we even get into this concept of health clubs being an essential community resource. Just with regard to the language that we're using as an industry, how should we think about maybe changing the language we use, or at least modifying it a little bit?
Yeah, it's a great point. Language really, really matters. And that was one of the most important take-home messages that I found from research that I did around physicians prescribing and referring exercise. Language matters in two senses. One is that I am more likely to use physical activity than exercise, because a lot of what I do is really about expanding access to physical activity opportunities, maybe in a healthcare setting, maybe in a health and fitness setting, maybe in a community setting. The other aspect is that I have really almost removed the word gym from my vocabulary. I am always talking about health and fitness clubs, health and fitness centers, health and fitness facilities, because if we as an industry want to position ourselves as partners with healthcare, then we need to really help providers and allied health professionals see us as allies and as partners in this healthcare continuum. And I think health and fitness is important to use as terminology in order to help further that goal.
Yeah, without a doubt. And I think it's so habitual for us to use the term gym owner, gym operator. I don't even think that people realize it. But when I think of gym, on some level, the first thing that comes to my mind is some horrible experience I had back in 7th grade gym class. And I can't help but think, how many of the, 80 to 85% of the population that don't go to health and fitness clubs really look at it as gym and go back to those same negative experiences from childhood. It's just so much deeper, I think, than what we realize as an industry in terms of the language that we're using.
Well, look at what a great job physical education teachers have done rebranding gym as PE.
Yep. Yeah, absolutely. And it's interesting. It's a lesson for our industry, certainly, which kind of brings us to the topic at hand, which is we're here to talk about health and fitness clubs as an essential community resource. And, it in the interest of not like asking the overly obvious question, but I have to ask it. Why do health clubs need to be an essential community resource when we look at the broad spectrum of the healthcare system?
Yeah, it's a great question. And I don't think it's purely COVID related, because my business partner, Tom Richards, and I have been talking about helping clubs position themselves as essential community resources. We may not have used that terminology, but we were certainly using the idea. We started talking about this in 2006 when we were working at IHRSA. Because a lot of what we were doing, working on government relations and advocacy, and ultimately I moved on to do more with health policy and health promotion, and Tom was doing more with strategic alliance building. But we were really sort of scratching our heads. We in the industry see what we as an industry do is absolutely critical to people's health. And we could not understand why, when we were fighting sales tax battles, for example, we were seen as luxury or amusement or fun and not critical to health. And so fast forward to the COVID pandemic, and we in the industry, again, see what we do is absolutely critical to health. And yet those outside the industry, in this case, decision makers who were able to keep things open or close them down, did not see gyms as essential. And so we really thought very long and hard about, well, how do we help health clubs be seen as essential by community stakeholders? And in the short term, being seen as essential meant being open for business. And really, but in the longer term, it's about building mutually beneficial relationships with all different types of community stakeholders. It's building relationships with school systems so that schools and health and fitness clubs are partners in getting school kids more physically active. It's about building relationships with local public health officials and elected officials. So clubs aren't closed, they're open for business, but also so that clubs are a trusted resource that policymakers can go to when they have a health issue that they need to solve, that health and fitness clubs can be a partner in. It's about being a trusted resource for healthcare systems that can refer their patients to health and fitness centers and know that they are going to be well taken care of by qualified fitness professionals, and they are going to move forward on a health and fitness journey that will improve their health outcomes. So that's a number of different examples, but it really is about building trust, building relationships with all different types of community stakeholders.
Yeah, that's great. And I think there's absolutely no one that's listening to this podcast that isn't sitting here shaking their head saying, yes, we are an essential community resource. And I think they've believed that for a very long time. I know I've believed that for the 23 years I've been in the industry. I'm sure very much the same way for you. We all believe this, yet it hasn't happened yet. And we're moving in that direction. But I think the first question I want to ask around why it hasn't happened, or what are some of the barriers that are preventing us from getting there right now? And then we can get into what we need to do to overcome the barriers.
Yeah, I think that it's really, and Tom and I talk about this a lot of community stakeholders don't understand what health and fitness clubs are doing, the extent of the exercise and nutrition programming that's taking place that is helping so many diverse types of people get physically active. There's this perception of the industry, and yes, perception is reality, and we've done this to ourselves as an industry. So much of what we do is about helping the fit get fitter. Mm-hmm. And if we can reach much, much broader segments of the population, the people who need what we offer, the programming and services that we as an industry offer the most, that will help to address this. They're serving such a small percentage of the population. There's no outcrying of anger when we're shutting them down. It's not about health, it's about vanity and fitness. And so we need to change that misperception, and it needs to start in the industry. And so what Tom and I did is early in the pandemic, we saw, a lot of talk and language saying gyms are safe, gyms are essential. And we agree that health and fitness clubs are essential, but we wanted to do more. You can't just say it and have community stakeholders take you at your word. So we actually put together a program that helps health and fitness clubs move from being a nice gym in town to being something that is truly essential. And the program is really us working with clubs to home in and focus on what they're really good at. Mm-hmm. And then to focus on what the community needs from a health perspective. Are there really high rates of diabetes? Are there really high rates of obesity and overweight? Are there really high rates of cancer? And position the club to best meet those needs, and to really think about what are the pain points of the community stakeholders. Do they have really, really high rates of child obesity and physical inactivity? And does the club have the beginnings of a relationship with the school system? And is there a way that we can match the need and match what the health and fitness club offers to find a solution that's a win-win for the community and for the health club?
Yeah, you said something, and I've heard it said many times before, and my ears always perk up when I hear it, is we've been making the fit fitter. I don't know if you know Doug Ribley. Do you know Doug? Doug ran the Cleveland Clinic's 3 medical fitness centers, and I was having a conversation with him recently, and he said that he was in a meeting, this was 25 or 30 years ago, with a bunch of industry executives that said, we're only getting 15 to 20% of the American population to come to gyms and fitness centers. We need to do something about this. And this was down at the Medical Fitness Association conference recently. And we were sitting in a room with a bunch of us saying exactly the same thing. And it essentially amounts to, we're getting the fitter. And there's a lot of things for us to do actionably as an industry to not leave that population, because to some degree they're our bread and butter and we want to serve them, but obviously we're not advancing the cause of public health if we're only working with this small slice of the population. So I'm curious, you said you developed a little bit of a protocol or a program to move clubs more towards an essential community resource, and I'm sure it's very extensive and far more extensive than we can get into on this podcast, but can you give us a little bit of a high level outline of some of those steps that club owners and operators could consider taking to move in this direction?
Yeah. So really overall as a protocol, as a model, we based it on a health coaching model. And so it's really health coaching for businesses. So we start off by, as I mentioned, really working with the club to identify what they already do well. And then we look at what the community really needs and try to marry the two. And then we develop a plan with the club. We never swoop in and say, this is what you need to do. This is what your community needs. They're the experts on their community. We're just helping them really maybe reframe what they already do, or in some instances, we're helping them see that what they see themselves doing well is not being communicated to the community. And so some of what we do is reframing. Some of what we do is developing best practices for certain types of programming. A lot of what we do is sharing COVID research, so we can frame for policymakers the really critical role that health and fitness clubs play in the time of COVID and after the time of COVID into the future. And so we develop this plan with the clubs, and then we work with them to implement and execute the plan over 12 months, working together, again, based on this health coaching model. So every month we meet and we go over updates. If they've developed a new program, we talk about how well that's doing. If they've developed a new messaging campaign, we talk about how that's resonating with members and potential members. And then we really talk through where we are and where we need to go. So trying to be really nimble and flexible and pivoting, because COVID has shown us, we think we're at a certain point in the pandemic and we've made a plan and members are going to come back and we can take masks off, and then we've got a new variant. And so we need to pivot and turn, and as always, show the incredible value that health and fitness clubs provide to their communities by helping, yes, the fit get fitter, but also helping the sedentary start to move, and helping people who may never have stepped foot in a health and fitness facility feel welcome and included. So there's a lot to that. So I'm always really excited about developing programs and ideas and initiatives for people that the health and fitness industry hasn't traditionally been able to meet the needs of.
Yeah. And the core of all of this, as I listen to you talk, is collaboration and communication out in the community. I think traditionally, as an industry, we've just been in the four walls of our facilities doing what we do, and we haven't reached out to all the various stakeholders in the community. And it seems like that's at the heart of what you're proposing.
Yeah, and I would say that trust, building trusted relationships is at the crux of it. And I think this really is also a carryover from my doctoral research, where I was looking at evaluating an exercise referral network. And the providers were referring both to a hospital affiliated health and fitness facility and to community-based health and fitness facilities. And not surprisingly, providers felt much more comfortable referring within the hospital network because they didn't know, understand, trust the health and fitness facilities. And so with the Essential Community Resource Project, working with providers, healthcare providers, is one relationship that we do work on, and building trust is a key piece of that. But we also work on building trust and building relationships with all different other types of community stakeholders as well. It could be corporate wellness, working with small businesses, or it could be working much more closely with healthcare providers to try to address that trust gap that exists, that our industry needs to address if we are going to be receivers of patients referred by their providers.
Yeah, you said it. Trust is at the crux of this entire conversation. And I'm about to ask you the most unfair question in the history of questions, which is how do we build that trust? Because that's always been the challenge. What do we have to do that? And also, probably on the flip side, what do we need to stop doing?
Yeah, it's a great question. I think that the research that I did with the Exercise Referral Network was really helpful. It really provided a window into what providers are thinking and what fitness professionals are thinking, and where there's synergy and overlap and where there isn't. And so I think a key piece of building trust is communication. And from the fitness professional side of things, they, in order to do the best job that we as fitness professionals can do, and what the fitness professionals that I interviewed told me, they could best do their job if they had as much information as possible from the provider. And the provider wanted to have that referral feedback loop closed. They wanted to get back information about the patient that they were sending to the fitness professional. So I do think communication and collaboration is key. I think education and awareness building is key. When I talked with providers, a lot of them really didn't understand what a certified fitness professional meant. They said, I come from healthcare. I understand licensure. Yeah. I don't have the knowledge of all these various specialty certifications. I don't even know what the equivalent is. And I certainly don't have time to go research it.
Right.
So a lot of it was based on people they knew, people that they trusted, who gave word of mouth referrals, but they didn't have the time to go out and interview every fitness professional. So I do think that raising awareness and education is critical. I also think that we need to really, we can be ambassadors for our industry as fitness professionals. We also need our clients and members to be ambassadors when they're telling healthcare providers about the great progress that they're making. So I would put that under the communication bucket. It's just a different messenger. It's the message of trust, and it's the trusted messenger. And we need to engage our clients and members to report back about what they're doing, because they see their providers and they have the inside track, and they could say, hey, you referred me to so-and-so, and I've been doing XYZ for this length of time, and I'm walking better, I have more energy, my stress is lower. And those are really, really key pieces of helping to build trust.
Yeah, that's great. And there's so many directions that I can go from there. I won't go down the electronic medical records. How do we close that loop? That is not it's 8 o'clock at night where we're both at right now. It's not a discussion that we're going to get into, but I do want to ask one hard question before we start to kind of move towards a close here. And you mentioned it. Do we need to move towards licensure if we are truly going to establish the trust with the medical community?
I think that we absolutely need to entertain that as an industry. I think that we have long held fast to certification and specialty certification. And I think that, it's interesting because all of these conversations always lead to discussions about EMR, and that's critical. They always lead to discussions about reimbursement, and that's critical as well. And I think that things are moving where we may be moving toward certified health coaches who have sat for their boards having their services be reimbursable. And so where does that leave health and fitness professionals?
Yeah, absolutely. It's very funny you bring that up, because I actually literally earlier today was talking with Margaret Moore, who has at Well Coaches, who has carried the flag for that. And basically with her and her team moved in that direction. It's such an interesting point. And I think you articulated it well enough that it's something that we need to entertain. There is a lot of complexity with that. I realize that, but I was curious to get your thoughts. One more thing I'm curious to get your thoughts on before we move towards a close. You've mentioned a lot about kind of your traditional chronic metabolic diseases, diabetes or obesity or metabolic syndrome. There's been a lot of talk about mental health as of late, and rightly so. Where do you see health clubs in terms of being an essential community resource, not just for physical health, but also for mental health?
I think it's critical. And I think there's a really, really important window of opportunity right now, because so often we've focused on physical health benefits of physical activity, and there are really critical mental health benefits of physical activity. And really during the pandemic, we've normalized discussions about mental health, because more and more of the population has suffered from real challenges with stress, anxiety, isolation. And so I think it's really important for us as an industry to talk about this all-important linkage between physical activity and mental health, and the role that we as an industry can play in addressing mental health in a health club-based setting. And I'm actually really proud to be working with the IHRSA Foundation and the John W. Brick Mental Health Foundation on a research project that will build the capacity of the industry to highlight and address this linkage between mental health and physical activity. It's a really critical issue that we as an industry can play a really important role in.
Yeah, and I've seen some of the communications around what IHRSA and the John W. Brick Foundation is doing. It's so exciting because this is such a untapped area of potential for our industry. And it's so important, which kind of leads me to a couple of our closing questions here, which is our industry has taken its lumps here over the course of the past 2 years. And I'm sad to say, I feel like we're not done taking our lumps yet. Saying all of that, what gives you hope for the future of our industry as you look at the entire ecosystem that you can view from your perspective? What gives you hope?
I am really hopeful because I believe to my core in the value that we as an industry provide to the world. I think that really a lot of where I see we provide value hasn't been highlighted enough. Mm-hmm. I think that, yes, there are really important health benefits of physical activity. There are also really important benefits to doing physical activity that is accompanied by social support. Mm-hmm. There are really important benefits of community and health clubs. And I think this comes back to something you said. We've been so focused on what we do in the four walls that we aren't as focused on what we can do for the community. But what we do in our four walls is build community. Exactly. And so it's a natural fit. We're building community within our club. And so we are more connected to the community outside of our club.
Yeah, absolutely. There's just so much potential, I think, because we've only viewed things through a very, very narrow aperture for so long, and we're starting to widen that. Man, Amy, I feel like there's a bunch of rabbit holes we can go down, but I want to move to a close here. And the next thing I'd like you to just make sure our audience knows is where they can find out more about you and what you're doing with your company. I'm sure a number of people listening would be interested to actually dive a little bit deeper.
Yeah, so I'm at movetolivemore.com, and I have lots of resources on there, what type of services Move to Live More offers. I have information about my podcast, the Move to Live More podcast. I have a blog that really takes my doctoral research looking at integrating healthcare and health and fitness and puts together a 10-step roadmap for health and fitness clubs of how they can become trusted community resources. And then I have information there about my partnership with Tom Richards, which is the Essential Community Resource Project, which we've talked about. But it's a project, but it's also a network. We're building a network of clubs that are thinking in this space and want to be perceived and seen by community stakeholders as essential. And we're putting together a network so they can really share best practices and ideas of what's working for them in their communities.
That's great. And we're going to link up to all that on the show notes page. And that last piece of collaboration is so key. We cannot do this on our own, in our own gyms, in our own silos. There's not only is there silos between, healthcare and fitness professionals. For years, there have been silos within our industry. And I think that this has been an exciting time where some of those silos are starting to get broken down.
I agree. I think it's time to knock down the silos. And you mentioned within the industry, yes, and across sectors, which is really where I spend my time. And how do we knock down those silos? And I've chosen to focus really on innovation, collaboration, and communication, which are the themes that have come up in our discussion together tonight.
Yeah, absolutely. Absolutely. And you mentioned your podcast, and just in case anyone listening can't get enough of Mike and Amy on the Wellness Paradox podcast today, I'm also going to be on your podcast that will be released on the same day. So if you don't have enough to do during your holiday season and you want a little more of Mike and Amy, we're also going to link up to how you get to your podcast in the show notes.
Great. Yeah, it's a twofer.
It is a twofer. Well, let's bring this to a close just in case people want to also get to that podcast as well. But this is a question I always end the podcast on for everyone. And you've touched on a number of things during the podcast that I think answers this question, but I'd really like you to focus it for the question, which is, I consider the wellness paradox to be the gap between the medical community and the fitness and wellness community. There are fitness professionals that are listening to this, and they want to close that gap off. If there was one piece of advice you could distill all of this down into to start to close off that gap, what would it be?
I think we've covered it with building trust, building relationships, building trusted relationships. I think that people are really recognizing the importance of trust during the pandemic, and we can be trusted partners with healthcare, with schools, with businesses, with public health officials. So how do we get there?
Absolutely. Build trust. Amy Bantham, thank you so much for joining us on the Wellness Paradox.
Thank you so much for hosting me. I appreciate it.
Well, I hope you enjoyed that conversation with Amy as much as I did. If you found it insightful and informative, please do share with your friends and colleagues. Those shares make a difference for us. Any information we'd like to share from this episode with you can be found on the show notes page by going to wellnessparadoxpod.com/episode 33. Please be on the lookout for next week's episode when it drops on Wednesday. And if you have a moment, please leave a review for us on your favorite podcast platform. Those reviews can make a massive difference for the Wellness Paradox. Have a happy new year. And until we chat again, please be well.